but then they don't separate it out by gender and by sex. And we're just lumped in with the men. And I mean, this is crazy because women are very different than men. We're not just like tiny men. And I think when you look at sex drive, like especially like something about sex drive in studies, in order to close this gap, we have to demand studies that are specific to women, because now we're just assumed to be tiny men and that testosterone is the main hormone for sex drive, right? So we'll even give women like 1/10 of the dose that we give men, and we assume that that's going to give her a sex drive. And it does, I would say for some women that does actually work really well. But we're dosing them with male products. Like women don't even have their own testosterone product to do this. So if we think that it's so important, like if this is such a critical hormone for sex drive in women, why don't we have a woman testosterone product on the market? Which we don't. We have women use the man product. And so again, we're not just tiny men. I think we're actually practically different species. Like studies of brains show that women are completely different than men. And sex drive is different. So if you look at the limbic system for women, there are receptors, which the limbic system is the part of the brain that we think is responsible for sex drive. And it is also with women, it's deeply connected with like the hippocampus and amygdala, which is emotional response and other, as well.